Okay, hello everybody. I am under the gun. Not under the gun. I sound like that lovely Tim Gunn. Under the gun. I'm here with Diana. Diana, I'm sorry I never give you the most flattering thing, but Diana is the most brilliant woman when it comes to lasers and laser treatments and Fraxel and all these things that you ask me about quite a lot. And I thought, as I'm going to do a little very light Fraxel today, I'm going to show you what it is and we're going to talk, and it's an opportunity for you to ask Diana any questions, because you always ask me questions about what's Fraxel, what's good for pigmentation, what's good for lifting my skin, if I want to do more than just vitamin C and retinols, what's the next step? So I'm being the guinea pig as usual. And we're starting off, Diana, today, and because on Monday I'm doing the cover of a magazine. It's very exciting, and I was feeling so tired. I've had 6 hours sleep a night, so I called up Diana and I went, Diana, help! So I just thought I'll try something, and we're trying today. What are we starting with, Diana?
We're starting with a little bit of lifting of the underlying muscles here.
So can we talk then?
Yeah.
So let's talk. If you're a woman in your 40s or 50s and you're feeling that your face is, this is for women where your jaw's going or you feel the sag, you're thinking creams can change textures, they can give elasticity. My microneedling gives a really good tension to the skin, but this is that muscle we're talking about, which is just going to go as you get older.
Which is not attainable except through surgery, okay?
Except through surgery. So this is things you can do. If you ever think, I might be a woman who's heading for a facelift, what could you do so you never head there? That's kind of what we're saying, isn't it?
Exactly. We're saying, how can we get down to a level that normally would only be attained by surgery, and how can we tighten that underlying SMAS, which is the muscle that we're tightening, okay?
Okay.
This
because
is superficial.
If we start on the most simple level, Diane, because you and I have this conversation ever, if we talked about categorizing treatments, so to me there's laser, there's fractional treatment like Fraxel, which is kind of needles.
Okay. What
which is
what
which?
fractional means?
So if we did a table, we did a table of laser, what's it do, infrared, what's it do, you know, muscle versus skin. Exactly. That's, I think, what would be really helpful for the ladies. Good morning. Can I just say good morning, ladies? You know what, Abby? It's not painful, actually. I've got a little numbing cream on, but it's not. And Diana's doing a gentle Fraxel. Fraxel can be very different. You can get somewhere there's a real downtime on the skin, and this is a really light treatment. Okay. But
so
do
what
say
I'm
what you're
doing
saying,
right
Diana,
now,
because I think
what
it'd be
I'm
interesting.
doing right now is a little bit of ultra lift, which is working on the underlying muscle, of the skin. Yeah. And I'm just warming up this whole area. You can see a slight red tone to the skin. That'll all go down. Yeah. Okay. The shininess, as Trinny said, is a tiny bit of anesthetic cream that she put on literally 5 minutes ago, so it's not giving her a huge anesthetic effect. Yeah. But that's going to be for the Fraxel part of this treatment, which is coming afterwards, okay? So I'm working on muscle, then we're going to work on her skin,
All right. So if a woman feels that she's got, because I want to, first of all, there's a lady here saying, how expensive is it? And I think, you know, I'm at Diana's and I've come to Diana for years, and you've got to go to a practitioner you trust. And so...
Then these treatments are expensive, okay? They are combining several different treatments, and this is what also you have to factor in. Yeah. It's the time involved. Okay, these treatments take about a half hour, okay? And a combined treatment like the one Trinny is having now is going to be in the range of about 800 pounds. Okay.
So it's a big investment. For some people, that's what they'd spend on creams in 3 years.
Yes.
For other people, it's what they'd spend on a weekend away.
All right.
So everything is dependent on your personal lifestyle and what you feel the benefit is. But I think, to me, it's a combination of, you know, if you're in a position where you can only ever do at-home treatments, then that's why I always recommend, Diana, microneedling, because I think it's a way you can do a home treatment which gives you something that maybe...
a level of satisfaction without too much risk, and that can give you a gradual improvement in your collagen, and in the firmness of your skin.
Exactly, which
firmness of skin being secondary to your collagen.
To your collagen. So when some people go, so there's a lovely lady here, Maria, I've never heard of Fraxel, what is it? So in a nutshell, Diana, in a layman's term.
Fraction means a part, okay?
Yeah.
So fractionated treatments, okay, are really, and this is why the microneedling became interesting, because it's not hitting the whole surface. Treatment, and there are several different Fraxel treatments, are going to be a different laser that is fractionated, so hitting your skin like tiny needles, but with laser. Okay.
So it's imagine it's just beams of light, but they're
that are separated, that are scattered in little pinpoints. Okay.
Great. That's a very good way to describe it, actually. Because even I didn't appreciate that. Okay. Yes.
That's what fractionation means.
All right. Yeah.
We're taking part of the light beam, part of the laser beam, and we're delivering it in small little aliquots, like little pinpoints.
Okay.
So
now, Diana, can I ask you something? Because some people are saying, oh, of course, that's very expensive. But I think, is it possible to go to somebody who was a qualified person in Fraxel and do something for less? Or do you feel to get a good person, you are going to have to spend?
It's a factor of time. Okay.
Yeah.
You have to realize that these treatments are also quantified by the amount of time it takes to do them. Mm-hmm. And yes, the price of treatments has come down. Mm-hmm. The Fraxel part of this treatment in the past would have been in the 600, 800 range. Mm-hmm. Now I can offer a combined treatment for the same price. So we're working on different levels.
Okay, great. All right, and in a way, one could say because the machinery has improved, one can do more. So it's like the expensive iPhone now. More people could have an iPhone.
Absolutely.
Still a good quality.
You have to realize that unfortunately our price is also determined by the price of the machines.
Yeah.
And the fact that the manufacturer of machines, like I always take the example of Ford Motor Company. Why did Ford make so much money? Because they made parts that you could not interchange, and you have to continue to buy their parts to make your machine work.
Ah, okay.
And
that's
those are expendable.
Yeah.
The heads that we use, we have to buy a head. So there's an expendable in each treatment.
Yeah.
Okay, and that has to be factored in.
Yeah.
It's not just the physician's time, it's also the wear on the machine, the maintenance of the machine, and the expendable part.
So somebody's asking, are the results instant? Now,
there is an instant result in what I will be doing today for Trinny. There's also a long-term result. Mm-hmm. Today, treatments are geared so that when you can actually go back to work pretty much within an hour to 2 hours after your treatment. Mm-hmm. So you will see an instant glow. Mm-hmm. And yes, there is a long-term effect too, which is the most important one, let me put it that way, because you're going to be then producing collagen and elastin as a result of the stimulus. Yeah. So she'll have a glow effect because there will be a slight edema to the skin, a slight heat reaction, which will actually be very equalizing to the skin and give a very nice tone. Okay. And many people will do this as a pre-red carpet treatment. Okay. Yeah. Why does everybody look so fantastic?
But let's just put it in the real world.
Yeah, in the real world.
Because pre-red carpet is sort of 0.0. So let's say you're going to get married. You know, big occasions in people's lives, Diana, where they think, what I want to do. I want to go that extra mile. I want to do more than a facial. Yeah. And what could it be? And I think women like that who've contemplated something which might be a big investment for them, and it's about how much downtime. When will I look my best after a treatment like this?
When will you look your best? You will look and if it were for a pre-marriage, we try to do it about a week around the marriage, a week before, 10 days before, so that you can have the full effect.
Or you might be mother of the bride, or you might be ex-wife and you're going to see your husband with his new young wife.
Yes.
You know, and you think, fuck me, I'm going to really make the effort because I want to look $1 million. But Diana, can we talk more, because you are the most experienced woman I know in terms of the use of, every day you're working with women's skin doing laser treatments. So can we just do the kind of simplest treatment to the most complicated treatments that are on the markets and the different things they do? So I'm having today, as for anyone joining later, a Fraxel. And so somebody's saying, is Fraxel good for stretch marks?
Fraxel is very good for stretch marks.
It is.
We treat a stretch mark like a scar.
Okay.
So what we're trying to do is to stimulate collagen and elastin and get reconstruction of the skin. Okay.
So if you have scars, stretch marks, what are the best treatments? Because I'm asked a lot.
The best treatments today on the market today are either straight Fraxel, okay?
Yeah.
We can combine it with platelet-rich plasma, which is very effective in bringing in new
which
cells.
Is my PRP Dracula facial,
exactly.
You know, the one.
And the other treatment that seems to be giving us very good results is using radio frequency through microneedles. So it's not microneedling without anything.
Yeah.
It is needling with radio frequency going directly into the skin. Again, fractionated because instead of one arc of radio frequency, we have about 36 arcs.
And that breaks down the scar.
It's not breaking it down. It's trying to get a renewal of the cells. What a scar is, it's an absence of elastic tissue. Okay.
Yeah,
and some scars that are hypertrophic, that's where your breakdown comes in.
Is that hypertrophic? So if you have a cesarean, it jumps one bit to skin over the other.
It's a bump because you overproduced. Your body went in overdrive.
Overproduction. I didn't know that. Right? Yeah. That's great. I learned something new from Diana every day. Well, that's very good. That Fraxel's good for scarring. Can I ask you something really simple? A lot of women have acne scars and they have other things, but I want to talk to you for a second about spots. I'm actually going to have Caroline here on, by the way, ladies. In the next couple of weeks, we're going to have a spot day, which I'm very excited by. But there's certain things I want to ask. If you have very bad skin in some ways, like really bad milia and things, what are the treatments you go to if you wanted to do more than just, you know, facial?
Milia does involve a blockage of the sebaceous gland, okay, a blockage of the pores and an accumulation of sebum, and that's what you're seeing as that little bump, okay? Facial treatments with using a tiny extraction can be done, but when there are a lot of them, it's rather hard, and you know that sometimes you walk out of the facialist with more rather than less.
Yeah, exactly. Yeah.
Okay. So yes, again, there we're going to be trying to take off a tiny layer of skin to unblock those pores. Okay.
So which treatment would you be looking at for that?
Quite honestly, I would use Fraxel, okay, or again microneedling with radio frequency.
Yeah, because I do think, I mean, anyone who's asked me about milia, I've said to them, get out the microneedling because you need to break down and take some stuff. So that I'm glad I'm giving the right advice because I need to get reassurance from you, Diana, because I'm not a doctor. But many people ask me, can we go back? Because a lot of ladies, because I got questions here, and I just got it's really good that we can answer the questions.
I'm going to get ready for the Fraxel part of what we're doing today. I'm just going to do around your eyes again for a little pulsation.
Yeah.
Okay.
Oh, can I just say, Diana and I were talking about puffy eyes, because Diana had really good info on puffy eyes. And I came in this morning and I said, Diana, I've had 5 hours sleep a night for, last 3 weeks really, and I'm really puffy. And we discussed it, and she taught me some new little things of pinching above the eye and under here, just some new lymphatic drainage things, which I'm going to share with you at home later, because I can't really share with you now. But we're going back to a question from... where is Diana's base? Diana is based in Wimpole Street, 25 Wimpole Street, and it's in London. So somebody was saying jowls. They're really, really wanting to know about dealing with jowls, saggy jowls.
Okay, let's just explain the facial dynamic of aging, okay?
Yeah.
Jowls are two-part, okay? Laxity in skin, less elastin in the skin, so the skin is looser, okay? You can see that Trinny's skin is very firm because she has had ultrasound treatments and skin-stimulating treatments.
Yeah, like my
The jowl is also a fat pad movement.
Yeah.
We normally have fat pads up here, okay? As we age, there is a movement where the fat pad is going to be down here, okay?
Yeah.
There are several things involved. There's muscle tension from the platysmal muscle that pulls down on this area. There's the skin laxity that we talked about. And then there's the fat slide. Okay? So depending on what causes the jowl, we will address it by tightening the muscle layer that pulls up, okay, getting a lifting effect, tightening the skin by stimulating collagen and elastin here to get firmness like Trinny has, where you can hardly pinch, okay? And we will sometimes also combine by relaxation of this platysmal muscle, okay, which pulls down. Okay.
So you mean as we get older, that muscle relaxes?
No.
Oh.
This is the superficial muscle. It's like a little sheet that goes over.
Yeah.
And that your trainer never tells you to stretch, because he's telling you to stretch the muscles that cause achiness, the trapezius. But this muscle is a superficial muscle that if you don't stretch and you do a lot of exercise, it's going to get tighter.
And therefore your gel comes down.
And it hangs onto your clavicle, so it pulls down as it gets tighter. Okay?
So how do we stretch it, Diana?
So we stretch it.
We just do that.
You do that, and you look over your shoulder, and you lift up your chin, okay? And you feel the stretch. Okay?
So, ladies, gel movement. This is a really good one you can do at home. The stretching of the clavicle muscle. I love that, Diana.
Yes.
Because what I love is something where there's going to be people here watching who can afford to come and see you.
Yeah.
There's going to be people who live, like a lovely lady lives in Dublin, and she can't. She's saying, where can I go to Dublin?
Yeah.
And there's ladies who are sitting there thinking, great, but I'll never be able to afford that, so what can I do? And I always want to look at most of those women.
She can stretch her
the stretching,
muscle.
and I still also believe in the AEIOU, that principle of that stretch. The facial exercising, the micro needling. There's a lady here saying, does micro needling help for jowls? We're saying yes.
We're saying that it will stimulate collagen and elastin. Okay, so
which will tighten your skin.
Long term, your skin will be better. Okay.
All right.
Will it make a major improvement? Probably not.
Not as major as something we might be trying here. All right. So
I'm going to ask you to keep your eye open, Trinny. This is just ultrasound, but I'm going to try to save your lashes from being... Okay, and we're just trying to pulsate the ultrasound in this area to get a little better lymphatic drainage.
Yeah, because I'm a little puffy,
Yeah.
too many late nights, and what Diana's trying to do is actually... So, oh yes, let's talk puffy eyes. So puffy eyes, lymphatic drainage, and what Diana was also saying to me, because I had said to the ladies, try and sleep with the pillow slightly up, but she was saying, kind of important to have a pillow under your feet, so you keep your feet up.
Okay. Not pillow under your feet, under your mattress.
Under your
at the foot,
mattress.
so you get a slight elevation.
All right.
Very slight.
Yes.
Okay. Otherwise,
Doesn't
what
hurt.
you'll do is you'll end up scrunching up in a ball because you won't like sleeping that way.
Okay.
So.
Okay. Depends to what extent. I mean, we also can have this conversation.
To what extent
are you going to
A little wedge under the base of
Okay.
the mattress is not a bad idea
All
for
right.
the majority of people. Okay.
And then,
unfortunately, again, after age 50.
yes. And then we did speak about the demon alcohol in terms that, you know, if you're ladies who said to me, what about puffy eyes, and you had a drink last night, that's kind of 90% of probably why one's having a puffy eye, especially over a certain age. Tell me, though, why that is, Diana. So why is it somebody in their 20s, perhaps, wouldn't get a puffy eye?
It's metabolic, quite honestly. Most women will realize that there's a difference after a certain age. They don't tolerate it as well. Is it the sugar flow? Probably.
The inflammation from the sugar?
Yeah. You really, women, everybody is more sensitive to sugar load. Probably around age 40.
Yeah.
But the fuller effect, obviously, as you get older, you really see it. You see it in your face.
And I see it from my addiction to ice creams because I also had two feast ice creams last night, and we have discussed about the correlation with puffy eyes and eating too much sugar. And I've got to say, that's what I have done. So, what, red or white wine best? Tell me. Red or white wine best? What do you think?
It's about the other things in the wine. Okay, there are different tannins and sulfates in the wine. Some people do better with red wine.
Yeah.
It has more polyphenols in it, so ultimately, medically speaking, more beneficial. Okay. Polyphenols being a major antioxidant and very good for your brain.
So
and
red
your
wine
arteries.
is better than white wine. Okay.
Yes, I would say that. Then there are individual variants with what has been added to wines. You know, we don't always know
because there's those
added.
things in wine.
And the things that have been produced by particular grapes.
Okay, I'm
so
going to do.
Sulfites can be higher in one or the other, and those can give other people more of a reaction.
Ah, all right.
Okay.
These are all okay. I'm going to do quick fire, Diana.
Yeah.
Can you do this treatment if you have gold in your teeth?
Of course you can.
Okay, that's great. Thank you very much. I'm just going to try and read here.
All treatments can be adapted, and we can, when we're going over this area with ultrasound, okay, we're talking about ultrasound.
Yes.
Laser you can do no matter what you have in your teeth.
Yeah.
Radio frequency and ultrasound are the ones because of the deeper radiation and the fact that radio frequency is attracted to metal.
Yeah.
We would put a guard in certain areas, and it's just covering your teeth so that we can work on the skin and not on your teeth.
Okay. Now somebody said here, does microneedling help with a deep wrinkle? So that lady,
you will get a very minor improvement, okay? But don't expect it to disappear because you've been...
So if somebody had a very deep wrinkle, would you say if you came in and had a Fraxel, you would get...
If it's very deep, you have to realize if it's very deep, you can consider it like a scar, okay?
Okay.
So it really will take volumization. Doing your own collagen volumization will take time. It has to be a long process.
Yeah.
Okay? It's a long process.
So if she wanted a quick process and had a budget, what would be a laser or an infrared? What kind of treatment would help with the deep?
Well, with a deep line, the only thing is going to be ablation. Ablation can be done by lasers, okay? It actually removes a layer of skin, okay?
So when you say the word ablation, just because it's...
Ablation means getting rid of, okay?
It means, so it's something that will take off layers of skin?
Take off layers of skin.
Through laser?
Through laser, and through, today we now can ablate with radio frequency. Oh. And that was the other alternate solution that I was going to tell you. We now can fractionate not only laser, but radio frequency, okay?
Okay.
Less downtime, crusting and scabbing, but that can be done gradually, okay?
Crusting and scabbing.
Okay.
Yeah.
Yeah.
Yeah, we don't want crusting and scabbing anywhere.
Manageable.
Okay. All right, let me just see if there's any other...
Fractionation of devices has made the downtime, the scabbing with ablation, much more manageable.
Okay. Some people are saying can't see or hear anything, just a black screen. That's Eloisa, but I think I've got enough comments to know. Okay, Trinny, please, treatments for whiteheads. I don't want to go on Roaccutane. Well, I'd say on a basic level, if somebody has whiteheads, Diana, Roaccutane would be an extreme treatment.
No, topical Roaccutane. Now we're talking about...
not the pills?
Not the pills.
Oh, there's now a cream for
There's a
Roaccutane.
cream.
Ah.
So that is, it's the other thing I wanted to add. You were asking me about devices for milia and inclusions. However, using topical Retin-A, it's the same thing, okay? Is an effective way. It will cause a peeling effect. It should be started gradually, okay? Because some skins will be hypersensitive to it. There are two things you have to know. Starting gradually, it will cause peeling and inflammation, but that's what we want, okay? And the second aspect of it is that you have to be aware that you will be sensitized to sun.
Yes, you must
so
use the highest.
So you have to stop that treatment 3 weeks before you go into the sun.
But you think then that would be very helpful. Can I ask you something?
Yeah.
And this is something I've asked so many people, and I sort of know the answer, but I want you to say it as clearly as it's understandable. There's many different people who talk about retinoids, vitamin A, and Retin-A.
They're all the same base, okay? What we're doing is we're causing a micro peeling effect, and again an effect on the sebaceous gland. Okay,
which is the
one
that overstimulates.
It's penetrating. It's topical. It's penetrating in. You're not going to have the same effect as Roaccutane. However, we consider a limitation. Again, for pregnant women, we try not to use any topical Retin-A because of the potential. And it's never been studied because it's 9 months. Nobody is going to study this on a pregnant woman. The effect on the fetus, okay? Because you do absorb a certain amount through your skin.
Yes,
okay?
and that's why they never let Roaccutane. You can't be. You've got to be on the pill to take it.
Not only internal Roaccutane, but also topical. Okay. Topical
also
being
topical,
all the Retin-A's. Okay.
Everything.
Those are all topical.
Yeah. Okay. So I hope that helps. Let me just see if there's any other questions. What is the best treatment for a marionette lines and downturn mouth?
Okay, there are two options. There's a muscle here, it's called the depressor angulus ori muscle. It's a little triangle that hooks on here and here right in the corner of your mouth. Okay? The quickest way to get a resolution is a little bit of Botox to relax this muscle, and the corner of the lip will come right back up. Okay.
Okay, and when I do my Botox, Dr. Sebagh, he does do there and there.
Absolutely, it's for the depressor angulosum.
All right.
Yes.
Okay.
The other way to get improvement in this area is to do treatments that will work on this muscle's capacity to contract. Okay, with the ultrasound, we try sometimes to really get deep into this muscle, not to make it contract less. Okay, and we can do that with ultrasound. We can create micro injuries in the muscle. So that it contracts less.
Yep.
When the Marionette line is very impressed, okay, very, very impressed in the skin.
Yeah. So somebody comes to you and they already have it. Yeah.
Yes, it can be filled. Okay, it can be filled.
All right.
And that will give immediately a smoother appearance in this area.
Okay, great. Thank you, Diana. All right. Let me just. Are we done? Are we done now or not? I'm just
going to.
Okay, great. All right. So, what would you recommend for removing facial hair? Chin and upper lip. I do threading, and I think it's fantastic. So I do believe that.
Yeah. It's very fine hair.
Yes.
Usually very light hair responds very poorly to most permanent hair removal treatments. You can get slight improvement. You can get a lessening of the frequency of the
Somebody has black hair. I mean, I don't know if this lady has dark hair. Would you do a laser?
Hair, yeah.
What laser would you do for that?
There are so many on the market today that are highly effective.
Do you think they work, Diana, if you have dark hair?
Oh, yeah.
They do?
They absolutely work. Okay.
And you'd need to do 3 or 4?
No, you have to do about 6 or 7.
All right.
Okay. You will get immediate results, but you have YAG, you have alexandrite, you have diode lasers, you have IPL lasers that are appropriate for this. There are all sorts of light-based treatments that are aiming at the color in the base of the skin of the hair follicle, so that it heats up and it shrinks.
So the darker,
the better. So you get a minimalization of hair in density first, and in the width of the hair.
Okay.
It's finer hair because you're getting
a minimization
of the hair follicle itself. Okay, as well as the density of the hair follicles, and that's why it takes several treatments.
And
it can only be effective when the hair is in the growth phase and when it's attached to the hair follicle.
Okay, that's great. Thank you.
Okay, so that's why it's several treatments.
How often should I microneedle at home? I did once a week with a 0.5. I got to say, I do, Diana, probably on a 0.5, I do twice a week. And I microneedle, and then I put in my serum, or I put in a peel enzyme product. So I think you can build it up. I think if you're starting, you could do a 0.2 needle, very gentle, build it up. I think at-home treatment should stop at a 1. I think that's quite high for anyone, don't you?
Yeah.
So that's my thought.
And it might be, according to how your skin reacts, you might do it once every 2 weeks.
Yeah.
Once a month.
Exactly.
It really is a personal issue.
Yes.
Personally, I don't do microneedling, either for myself or for my patients. So I'm talking to you about medical documented experience, okay? I'm not talking about a personal experience. But this is a personal thing that you are doing yourself, so you have to be able to gauge how you react.
Exactly.
And the first thing that I would suggest is don't do anything that seems harmful, okay?
Yeah.
If you don't feel you're getting the appropriate result,
then,
if you feel you're worsening, then don't do it.
Yeah, very
and
true.
go get more advice about it.
Yeah. Okay. That's
Technique
good
is
advice,
important.
Diana. Technique is important, and I have actually done a lot of Facebooks with gentle technique and not scratching the skin and all that stuff. Yeah. So
and appropriately cleaning the device.
Yes, and surgical spirit on it, make sure it's very clean.
Absolutely.
So we've gone into that. I think I'm going to refer the lady back to a couple of posts before on YouTube, you can see it, where I talk in detail about microneedling, and also the same facial exercises, because I had in a lovely lady who's a beauty editor of Vogue Brazil, Glamour Brazil, and she did some facial exercises with me she got from that fantastic Japanese woman, and so have a look at them, and I'm going to do some more next week with somebody else. So
I'm just putting a little cream so the Fraxel will slide on Trinny's skin, okay, and any slightly oil-based cream will be effective, okay. Usually patients have anesthetic cream on, and that's why it's all we need. We take off the top, the superficial, and then we can go right ahead with the Fraxel. So we're doing a little glow treatment for Trinny, okay? And you will see that the skin will be getting red.
Yeah.
And then it's going to have a very nice appearance. I would normally run out now and get an ice pack to put on Trinny's skin, but I will get it afterwards, okay?
So there's a lady asking here.
A
lot of cold air. All right, so it's going to be loud. I'm just going to do a quick fire questions. What are the long-term benefits of fillers, Botox, etc.? That's a very general question. I think it does do, you know, if you do, I've done Botox since I was 35 and I feel my skin as a result is tighter. And we might be going under the gun a bit too much now. Now this Fraxel is a little bit painful. I sort of clench my buttocks when I'm doing it so that I don't feel that I notice it so much. It's like, what is it like? It's like you
probably a heat effect that you're feeling.
A little heat effect. It's like I slightly, I don't know what I could compare it to. You catch your nail on your skin a bit, maybe.
Keep your eyes closed.
Okay, keep my eyes closed. Keeping my eyes closed. Okay. Yes, alright. Tell me something, Diana. Take my mind off it.
Now you can open your eyes if you want.
Thank you. Okay. So I'm trying to read questions here. This is all...
So on the forehead, Trinny's feeling it a little hotter. There's less subcutaneous fat here.
Yeah.
So she will feel the heat effect more. And you can see how this is already looking very smooth and glowy. Okay.
Smooth and glowy. Ladies, I'd love... Yeah, I won't read your questions at the moment.
Perfect, honey.
Yeah.
Okay, eyes open.
Okay, I'm now going to try and read this. I've been having a lot, so I can't read. Ladies, it's very difficult for me to read your questions. I hope we've done. I think now, Diana, I'm going to just, we're nearly done, or we're going to be.
We're nearly done.
So, if somebody feels that they...
Okay, all done.
No, that's okay, all done.
Okay, we're going down to the other half of your face.
Okay. So, basic benefits again of this Fraxel Glow. Skin softening, you call it?
Yes.
So the word glow, people associate sometimes with shiny. Do you mean that?
No.
What do you mean? Tell me what you mean.
A healthy appearance to the skin, like you've been exercising, okay, and you just have a lovely blood flow, and that's visible on having tiny bit rosy cheeks.
Yeah.
And just a youthful plump to your skin.
Okay. And how long will it last?
Well, as I told you, you'll have an immediate effect that will be for about 2 weeks. It's going to be very attractive, but then we want the long-term effect, which will start in about 3 weeks.
Yeah.
New collagen and new elastin.
Okay.
Okay.
I'm excited. All right. So, ladies, this is something. It's not for everyone, but as you know, I like to be a guinea pig. I like to show you.
We're going to do your neck, Trinny.
Okay, darling. That's good.
Hotter.
It's going to be a little hotter. And I'm just going to, can this help with rosacea? This is a very good question, Diana, because rosacea...
Rosacea this is not an indication when you have rosacea. There are other laser treatments that are highly effective, but Fraxel being slightly inflammatory, we never start with a Fraxel on a rosacea patient.
But no, what I want to ask you...
It might be indicated afterwards, but not initially.
What is good for rosacea?
IPL and NDAG, vascular laser treatments.
So
are very effective.
They are. So
they are an immediate improvement in rosacea. Of course, there can be a slight inflammatory phase because rosacea is an inflammatory disease. Let me put it that way.
Yeah.
However, they are actually solving the issue by coagulating the superficial blood vessels.
Okay, so slow down a second, because lots of my ladies have rosacea, and I'm really interested in this.
Okay.
So if somebody wants to consider a long-term solution for rosacea, there is one.
There is
what you're saying? There is.
Absolutely.
So you could actually get rid of it?
Yes.
Okay, ladies who have rosacea, this is really interesting. So what would they actually have to do?
They would be trying to do those treatments that I spoke to you about. IPL or vascular laser. And depending on the severity of the rosacea, the number of treatments, I usually get good improvement after 2 treatments, but you have to realize that we don't know what causes rosacea.
You don't know.
So I always tell my patients, just bear in mind that if the underlying factor is still there, you have to consider doing about one treatment every 18 months, once a year, depending. Right. Again, it's considered an upside-down treatment, okay? What makes you red are these superficial capillaries that are dilated, okay, for X reasons, okay? I do not do the tree trunk, which is the vein. I trim the roots, okay? By coagulating the superficial vessels. So you will have improvement, not only of the sebaceous glands, because they no longer have the blood flow, but of the redness, okay? So you will have an improvement. It's not the end-all treatment because we don't know what causes it, but it will be an aesthetic treatment, and you will look better, and you will not have breaking out and spots and everything that goes along in the whole dimension of rosacea.
That's. I mean, I think that as a treatment, I have to say, Diana, because I think it's something that affects people very badly, that is that's a fantastic investment.
Yeah, that is an investment.
Whatever your budget is,
if
to feel.
It's something you should do. Okay, but don't expect a one-off. Usually two, maybe really depending on the severity. Okay. I'm just going to do one little flash under this eye, one more.
All right,
eye closed. Perfect.
That's it.
Okay, you're done.
So we're done. So you can see here, I'm just going to try and show you. My skin is a bit red, but not...
This is going to come down in about an hour.
All right.
The initial heat effect will dissipate very nicely in an hour.
Yeah.
And we're also going to put a little ice pack on Trinny now to get a little vasoconstriction to stop the red flush.
Yep.
And she will be able even to put makeup on now if she wants. This is not, there's no breakage in the skin with the Fraxel.
Yeah, you can see close up there.
All right.
Yeah.
Okay. So I'm going to get an ice pack.
Thank you so much, Diana. So ladies, I hope this was helpful. I think it's good if somebody can be a guinea pig for you. I think if you're at home thinking, I'd never go and do anything like this, think of what you can do at home with a microneedling, with facial massage techniques that will actually stimulate that collagen and give you the tightening that you want. These are more extreme things. They're not as extreme as considering something like a facelift or surgery of any kind. They're that sort of in-between, and it depends how vain you are, and it depends how much things affect you. But I think, Diana, our conversation about rosacea and milia was fascinating, and I think for women who really suffer from some kind of skin condition, to come and do treatments like this is worth saving up for sure. Anyway, ladies, very nice chatting to you, and thank you everyone for watching. Bye-bye, Diana. Thank you so much for your input. It's really great.